Hello, my name is Nayeli, and today we will be talking about cervical cancer. This problem exists primarily because of HPV, or the human papillomavirus, which is a sexually transmitted infection. When a person becomes infected with HPV, the virus releases proteins that turn off tumor suppressor genes. These proteins are the E6 and E7 proteins. What they do is change normal cells to become abnormal, which eventually become cancerous cells and become cervical cancer. Due to many factors such as accessibility to healthcare, inadequate health services, and women's knowledge, there is a lack of screening, so women don't even know they have cervical cancer. Symptoms don't really show until the cancer is advanced, so without proper screening, women don't know if they may have it. Unfortunately, this cancer is the second most common in women worldwide. The way women get cervical cancer is because of HPV, smoking, which causes damage in the DNA, long-time use of birth control, many sexual partners and especially unsafe sex, and early pregnancies before the age of 17. Any woman in the world can get cervical cancer, but those from less developed countries have a higher risk because they do not have proper screening methods. Some risks for the community include having high incidence rates, since the HPV transmission is easy. Also, cervical cancer can lead to early menopause and infertility issues. If there is a woman between the age of 20 in their 20s or 40s, her risk of getting cervical cancer is higher than if she were younger than 20 or older than 40. Also, different ethnicities have different incidence rates, so some are more at risk than others. For example, Hispanics and African American women have higher rates than other groups. If a woman has a weak immune system, which can be because of HPV or other reasons, she will have a much higher risk of getting cervical cancer. One strategy in solving this issue is by having more resources available in more areas, especially in developing countries. It is necessary to provide all women cervical cancer education and free pap smears. In many cases, these resources are limited to urban communities or they are non-existent, but it's important to understand that 83% of all cervical cancer cases are in developing countries, so the resources need to get out to them. Another strategy is enforcing the HPV vaccine and pap smears through public policy. It is known that HPV causes 99.9% of cervical cancers and that this vaccine reduces the risk of the cancer, so it's important that adolescents get the vaccine. Starting at the age of 12, it is recommended that they get the vaccine. There are side effects such as swelling in the arm, nausea, and dizziness, but it's important to see that the pros outweigh the cons. For the pap smear, women should get them starting at the age of 21 every 3 years until they are 65, or every year if the test results become or are abnormal. Here are two examples of countries that are working hard to eradicate cervical cancer. Australia is having free vaccine programs in schools that have already shown big drops in rates. In the next 40 years, they are expecting just a few cases. Their national screening program requires pap tests every 2 years, and this test detects high-risk HPV infections before the cancer even develops. Ian Fraser, co-inventor of the vaccine, says it doesn't matter what country, if you provide the vaccine for free, people will take it up. So it's very important that women all around the world have access to the vaccine. In Sri Lanka, the University of Alabama in Birmingham, the World Health Organization, and the Sri Lanka Ministry of Health are working together to provide very low-cost prevention, screening, and treatment resources to get rid of cervical cancer. So far, rates have been dropping as well. So what does literature say we do? Focus on prevention. We know there are 3 branches of prevention. For primary, it is important to get the HPV vaccine. For secondary, early detection through screening is essential. And lastly, for tertiary, we need effective treatment to reduce the incidence of cervical cancer. We also need to make sure all women have the chance of getting tested and getting treatment. So it's important we get the resources out to all women worldwide. I believe it is extremely important to educate people about this topic and provide them with free preventative resources. Public health advocates and governments need to work together to fund programs so that all girls and women from all economic backgrounds have a chance to prevent, detect, and treat cervical cancer. Here are all the sources I used for my research. Thank you for listening.